This time. I know it's the last session of the day. You're hungry, so thanks for being here. We hope that this actually kind of caps off the day a little bit nicely. We're bringing a different lens into a lot of the topics that are being talked about today. So both Jennifer and I, thank you all for being here. My name is Joe Balabis. I'm with San Mateo County Behavioral Health and Recovery Services. So we are the county mental health provider in San Mateo County. So in that sense, it's already a different lens from some of the topics that we're talking about today. And I have my colleague.
Hi, I'm Jennifer Merrill. I'm a professor of psychology at Skyline College, which is in San Bruno in the Bay Area.
So we're going to talk a little bit about this partnership that we've undertaken to really bring up the discussion of stigma among college students. And Jennifer actually teaches an abnormal psychology class at Skyline College, so that seemed like a perfect venue to do this type of partnership. So in terms of what we're going to be talking about today, these are the standard learning objectives that we put in our abstract, so I just felt we had to put it up here. I'm going to talk a little bit about the approach that we take in this series that we do. A lot of it uses media, showing video clips, using photography to raise the issue about stigma. We're going to talk about how we use this tool called Photovoice, not its entirety, but at least in its participatory photography piece, to really increase student understanding of what stigma is, especially around labeling, because in our experience, that's how students relate to stigma, is labeling, what labeling can do, what labeling looks like. And then I'll talk a little bit also about some potential opportunities for partnerships in incorporating education into college psychology courses, but really at a more fundamental level, I think what I wanted to talk about is just how this type of a partnership can open the door to many types of opportunities. I think when school campuses may think about, well, who are some people that we can partner with, the local county mental health department may not be the first person they think about, or may not be the first agency they think about, but in a lot of ways it makes sense. Your campuses, I was hoping there'd be more people here from schools, but schools and colleges and universities are all part of larger communities. They're part of cities, they're part of counties, and so me as a county employee, my constituents, include the students at these campuses. So I have to also think about what their needs are as well. And so it makes sense to think about a county mental health department or county health department as a partner in doing this kind of work, because the work kind of goes beyond just what you do on your campuses. So for those of you who don't know, I was going to do a really quick introduction to San Mateo County. We are located in the San Francisco Bay Area. We are the county located immediately south of San Francisco and north of Santa Clara County. Our population is roughly around 710,000 people. Skyline College is one of the three community colleges in our county community college district, and it has a student population of about 8,000 students. And they're all from different backgrounds and sectors that really represent our community well. Our County Behavioral Health and Recovery Services, I'll just call it BHRS for short for now. We are the county mental health department that provides direct clinical treatment services, but we also provide training, prevention services, technical assistance to communities and local CBOs. We manage, or I manage, the prevention and early intervention programs that are funded by the Mental Health Services Act. So those three initiatives are the Stigma and Discrimination Reduction Initiative, Suicide Prevention, and Student Mental Health. And for the purposes of this presentation, the Stigma, Discrimination Reduction, and Student Mental Health piece are where the impact is going to be the most felt in this partnership. We have a unique kind of infrastructure arrangement in San Mateo County where our PEI programs are actually housed in what's referred to as our Ethnic Services Manager's Office. So every county in the state of California are required to have an Ethnic Services Manager to address things like health disparities and health equity. For us, it makes sense to structurally house our PEI programs in that office because that office has a strong history of promoting health equity. There's a social justice aspect piece to it. And when you're talking about things like stigma and discrimination reduction, you'd want to be able to utilize those strengths in emphasizing that. We also have a really core fundamental belief in community outreach engagement and forming these non-traditional partnerships, which is why when we outreached to Skyline College, it was something a little bit new for us to do, but it made sense. And then as we're doing it, we thought, why didn't we just do this many years ago? Because this seems like it makes sense. So I talk about this because there's a reason why why the work that we do kind of links well with the class that's going on at Skyline College. So this partnership that we formed actually was kind of an extension of work that we've done with Skyline in the past. We, as a department, offer trainings, staff development type of trainings, and even limited trainings to students around mental health education and awareness. We provide assist trainings that Skyline College's staff have attended. We've provided mental health first aid trainings for years for both faculty, or for faculty, staff, and students, and they're pretty well attended. But it wasn't until about a year ago we approached Professor Merrill. We were introduced through actually one of the counselors in their psych services department with the possibility of doing a seminar or some sort of a presentation on stigma, because we wanted to get the discussion out there. We wanted to find ways to engage students and younger adults around this topic of stigma. And because she taught the abnormal psychology class, it seemed like it was a perfect entry into the university, or into that group of students. But after we sat down, we talked about it for a little bit more. We realized that a one-time class wasn't going to cut it. We needed to kind of do something more, something beefier, something that involved more discussion, more interaction with students. And so the idea evolved into a 4-part series. We agreed to do a 4-part series to more effectively address stigma. The emphasis would be on discussions, facilitate discussions with the students, a group assignment, something that they can kind of work together to put together, and really try to highlight story sharing, either from people with lived experience or their own experiences that they brought to the table. And really, this was kind of our first attempt to integrate our stigma efforts with more of the student mental health efforts. And if you're familiar with kind of how these 3 different programs run, there's a lot of opportunities for overlap and for collaboration, but sometimes they live separately from each other. So this is really our first attempt to kind of integrate the work that both of those pieces were doing. So this is kind of how the series looks like, and how the series runs, and how I actually come into Professor Merrill's class and do it. So it's a 4-session series, it's about 50 minutes each. The first day is really kind of the lecture heavy piece. That's where I come in and talk a little bit about what mental health is, what a mental illness is, and what stigma looks like. But I really try to incorporate a lot of video kind of components into it because I feel that that's how a lot of younger adults have resonated with the messaging, is when they actually see these videos. And so I include some video interviews of Brandon Marshall. Are you all familiar with who Brandon Marshall is? He's a wide receiver with the Chicago Bears. He's very open about his borderline personality disorder. He's done interviews on ESPN, on Fox Sports, about stigma and how it feels to have this diagnosis. And he's very open about talking about it. And I think that's a great role model to have, especially considering he's a professional athlete. And I also show a clip of Demi Lovato, who's a pop singer, and a lot of the younger women associate with her. She gives an interview with Good Morning America about being diagnosed with bipolar disorder, and how that was like for her, and how she felt relieved to actually hear that this was something real and wasn't something that was making her crazy. So she actually talks very openly also about her diagnosis. So I think those 2 interviews are cool things to lead off with. I also do this video. It's called Stigma Among College Students. If you just search for it on YouTube, it was made by Catholic University, and there's some students who go around and film interviews they have with people on campus, and they ask, what do you think about mental health? What does that mean to have a mental illness? And the different students kind of give their first impression. So it's a kind of way for them to see, well, other college students may be thinking the same things as you are, but here's what the reality really is. And then I do a kind of a labeling exercise, and this is where when I talk about stigma, I really bring it in terms of labeling, and how I describe it is, stigma really is about labels and how people get treated differently because of those labels. And how I bring it closer to them is I ask them to think about, what are some labels that you associate with yourself? Like, how do you identify yourself? Are you a son, a brother, a student? And then what are some labels that other people have given you over your life? Whether they're positive or negative, and people will say, well, I've been called freak, I've been called weird, I've been called stupid, I've been called slow, fat, whatever. And then I ask, well, those labels aren't how you, may or may not be how you identify yourself, and how does that make you feel? And that's where people start thinking about, oh, okay, so that's what you're talking about when it comes to stigma. So it's really a way for them to associate with what stigma actually is. And then sessions 2 and 3 are really about the Photovoice group work, and I'll let Jennifer talk about that in a little bit. I provide a lot of support for them to really think about the assignment. They bring their pictures to class. I give them some feedback and maybe some suggestions on what could work with them. And I answer some questions about, if they have even more questions about stigma, if they're more confused about it, then they ask me some questions. I can provide some feedback to them at that point. And then our exhibit is actually displayed on campus, and that's one of the cool things that we actually got permission from the school and from the students to post up their work on campus, and that's a chance for them to see their work, but also for other students to come and see their work. And that's been actually a very powerful way to get the message out there too, is when they actually have an opportunity to see their work on campus. And in the final day of class, I come back and I actually debrief about their whole experience, and I use that opportunity to talk more about what resources that we can provide as a county health department, what resources are available on campus for them if they need additional support, and I encourage them to sign the pledge. We have a county pledge that we actually modified from the Each Man Matters campaign that's specific to San Mateo County. So that's an opportunity for them to sign the pledge and actually, if they want to get more involved in our campaign, to actually do that as well. I put down here optional Stigma speakers panel between sessions 2 and 3. We've been able to do this to provide a speakers panel once, but we weren't able to get them the second time. So it's a great opportunity for college students to actually meet people who have lived experience with a mental illness. And so we invite one of our peer-led speakers panels, they're called Stamp Out Stigma, to come on campus and to come to this class and have people talk about their experiences with mental health and challenges. And because they're coming on to a college campus, I ask if they can bring actual college students who are speakers or members of the speakers panel to come and speak. And so they're able to bring some college students with them for this panel. And they say, well, my name is so-and-so, I'm a student here at Skyline College, and this has been my experience with mental health challenges. I think that's a very powerful tool for folks to actually see. In terms of the approach and rationale, the reason why we designed this approach the way we did, not only because we thought it would be cool and different, but they actually are based on successful strategies for changing stigma, and a lot of the strategies that I follow are the ones that Pat Corrigan and Rowan Sang talk about in their book, Challenging the Stigma of Mental Illness. It's a great book that talks about research and successful approaches to changing stigma that they found, in the research. And so these are just some of these 4 points are just some of the strategies that they highlight in that book, and what we've done to kind of integrate those strategies into our series. So programs that explore myths and facts. If we do a true and false kind of session in the very beginning of our first session, the interactions between the public and people with mental illness, that's kind of what the speakers panel is all about, and also those video interviews. Value self-confrontation, that's kind of a fancy term to give people the opportunity to think about how they view mental illness and how they view people with mental illness, and start thinking about, well, maybe I've been thinking about this the wrong way. Maybe I need to change the way I address people, or I treat people who have this condition. So that's kind of what's going to happen with the Photovoice piece. And protest discriminatory practices, that's again another fancy way of saying, take a stand against this whole thing, and that's what the pledge signing is supposed to be for. So a little bit about the Photovoice methodology. Photovoice is actually been referred to as a community-based participatory research model. It's a form of participatory photography that was developed by Wang and Burst in 1992, and they're both at the University of Michigan. It uses pictures of existing conditions or existing situations, and it's coupled with a short narrative about the picture to answer research questions. And as a research model, it's really been successful, especially with groups who aren't traditionally represented in research. This could be because of language issues, because of socioeconomic status, such as they're poor or impoverished, or age. And this methodology has been especially useful and has resonated well with young people who feel like they don't want to participate in traditional research, or they don't feel they want to do it in that particular way. Photography gives them some sort of a creative outlet or creative way of expressing themselves. So I think that's why we used this method for this portion of the class. In its purest form, Photovoice is meant to stimulate action, advocacy, and social change. Obviously, we can't really get into that when partnering with a university or with a college class. But it would be interesting to see if anything does come from this down the road, if we continue to do this partnership, if there's something more that either the students want to do with it or that the school would want to do with it, or if we wanted to do anything with it. So that's what I'll talk about in terms of the background of the assignment, and in a little bit I'll hand it over to Jennifer, who will talk about the meat and bones of how we actually did this. Here's kind of a picture of what the exhibit looks like at the very end. I think it's important to note that this is very low tech. And we'll talk a little bit about why that's important when we talk about the costs of actually doing this. They printed this up on their own, they did this on their own, and we just posted it up at this wall in one of the buildings on campus. So this is just actually one section of their work. And there's another side of the hall where they actually had more pictures, and it turned another corner and had more pictures down that hall as well. So I'll turn it over to Jennifer, who's going to talk a little bit more about how we did this in the classroom.
Great, okay, so my part is called the classroom perspective. And what's really nice about this is if you're interested in doing this, you can go to a faculty member and say, I have it done for you. There's no prep time for you or anything like that. It's all taken care of, and here's what we need to do. So this is how we went about doing the assignment. The prompt that we gave students is to take 3 to 5 pictures that answer the question, where have you experienced stigma or discrimination? And we wanted to leave it really open and general that way. It makes it easier for the student, but also it really allowed the student to personalize the experience of stigma and the idea of stigma. So they went out and they took 3 to 5 pictures that answered that particular prompt. And then in small groups, they shared their photos with their group mates. And their groupmates decided which photo they thought they should post. So, for example, if the 3 of us are in a group, I'd come and say, here's my first photo, here's what's going on, here's my second photo, here's what's going on. The group might say, you know what, go with photo number 2. That's the most powerful photo. So the group gave a lot of input into what photo they felt each student should post. So once the student decides what photo they want to post, they write a narrative, and that includes a description of the picture. So what's, what the picture is of, what's going on for them, how they experience the stigma or discrimination, and then how stigma might affect a person with mental illness. So this allows them not only to take the concept and apply it to them, but also apply it in a broader context as well. So as Joe mentioned, we did this over a series of sessions, and the way that we've kind of set it up is Joe's kind of part of the class. We started this semester, I think, August 18th. He's already been in to say, hey, I'm Joe. I know that Jennifer's told you about Photovoice. I just want to introduce myself. So you're kind of a part of the class. He's not a guest speaker. He's this like interwoven person, which is really nice. The students enjoy seeing him. So week 1, students, we put them into groups then, but actually they kind of self-select. We don't say, you guys are in this group, you guys are in this group. We start doing this, I think, October is when we ask them to break into their group. So by that time, they're familiar with the people around them, gotten to know people around them, kind of self-select into their own group. And we give them the formal assignment. Now, at this time, it's really, really helpful to give visual examples because students may still not be sure what we're talking about or exactly what they're looking for. And so last semester when we gave the assignment, Joe had specific examples there. But we also asked the class, have you guys started working on this? And if you have, would you want to share those with people, what you're thinking of? And students were raising their hand left and right, going, I'm thinking this and this and this. And that was really great to help other students kind of brainstorm or think about maybe what they would take a photograph of. So examples in week 1 are really helpful. During week 2 and 3, students go out, they take their pictures, that's when they come back, they get into their groups, they share the photos with their groups, and then decide what photo they want to post. And you know what, if the group says number 2, post number 2, but you're really feeling number 1, you can stick with number 1, so it's ultimately up to the student. And so that's what's going on there. And they're also writing their narrative. They decide what they're going to do and write their narrative. During week 4, I collect those. And then you saw how high tech it was. I took my stapler and went boom, 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 boom. That's all it was. It was just stapled to the wall. So I think what I did last semester was I collected them on a Monday, and then that gave me time to get them up on the wall. Also, students, if they used faces, any recognizable face, they had to have a waiver signed, and I had to make sure that I had those for any faces that were going to be shown. It also allowed students who were running behind some time to get their photos to me. I literally had people showing up Friday morning when we had the exhibit going, please post it, please post it. So we just scotch taped them to the wall, at the end of the wall. So they really wanted their work displayed. They were excited about it. So I had them due on a Monday, and then I put them up on a Friday. And then what we did was, instead of meeting formally in class, we met in that hallway, and that was the class. We just looked at one another's exhibits. And then, as Joe mentioned in our last session, he comes back, asks what you think about the experience, and then talks about some really concrete ways that you can, on a personal level, try to reduce stigma and discrimination. And then they, in turn, write a paper that incorporates those ideas. So here are some examples. I have 3 examples of photos that students posted last semester. And this first example has to do with medical illness. And it was an illness that her father is diagnosed with, which is diabetes. Now, the culture that she is from, having a medical illness is something that is very much looked down upon, particularly having to take medicine on a daily basis was something that was very much stigmatized. So he hides his glucose monitoring system underneath the bathroom sink, clear in the back. And just goes in several times a day to test himself. And she said, we all know what's going on. Everybody knows what's going on, but nobody's supposed to say anything, because he just felt a lot of shame about that. This is a picture of a student who talked about labels that were applied to her. You can't really tell that she has green hair. So her hair is green. She's got piercings in her lip, right here under her nose. She's got piercings here. I think she's got them in her eyebrow. She's got tattoos. And her narrative says, have you ever been discriminated against? I sure have. I get called free or a loser. And talks about how those labels affect her, assumptions that people make about her based on her appearance. This last one was a picture of Skyline College. And Skyline College is located in San Bruno, and we are in a pocket of fog. It can be sunny everywhere until you turn on campus, and it's totally foggy. So the coolest thing to me about this picture is there's no fog. You can actually see that it says Skyline College. And the stigma that the student wrote about was going to community college. She said, I graduated from Cal, and I've decided to go back and apply for programs in physical therapy, and so I'm knocking out prerequisites at Skyline College. And when people ask me, where are you going? And I say Skyline, they're like, why? And she said, and I feel defensive, and I hurry to tell them, well, I graduated from Cal, and this photo students responded to a lot. This one got talked about a lot. So as you can see, people are coming up with all different things. We had one student who 70% of his body is tattooed, and he took a picture of his tattoos, and he said, I have people coming up to me all the time going, what'd you get out of? Or, oh, you must hate your parents because you tattooed your body. And he said, you know what, my whole arm is dedicated to my father. It took me 2 years to plan out what I was going to put on my arm, and it's very significant and meaningful to me that people see me and they cross the street. So they were all. Can you think of any others in particular that really stood out for you?
Yeah, I can actually think of one example. There was actually a picture of a person just from the top down. He actually worked at the MAC cosmetic store, and he said, I'm a guy who works in a cosmetic store, and people think that because I work in a cosmetic store, I'm gay or I must be weak or whatever, and that's just like saying women can't be police officers or firefighters. And he said, I like my job, I enjoy my job, I enjoy what I do, but that just because I work in a cosmetic shop doesn't mean I'm, I fit this particular stereotype. And I think the value of these pictures, that first of all, we didn't know what we were going to get when we did this.
No idea.
And when we were talking about it, we thought, okay, they're just going to go for the easiest thing, race or gender or something like that. The people dug deep when they came up with some of these exhibits. The glucose monitor was awesome. The tattoo one was phenomenal.
Handicap placard hanging from the car.
Right, handicap placard hanging from the car. There's pictures of like religious icons, and they were talking about religion and how mental illness plays into that. And so they were hitting a lot of just different sectors. And when I was walking through it, I was just beaming from ear to ear because I was thinking, wow, they got it.
Yeah.
They got it, they understood it, and it became very personal for them. And so they were talking about it. And so you'll see in the next couple of slides, people were going around each one, they were reading it, they were taking pictures of it.
There you go, yeah. And it was funny because when they started showing up and filtering in, I had this expectation that they were going to be like looking and talking to one another and chatting it up, and it was quiet. I mean, it was quiet. And then I told Joe, I'm like, oh, what's happening? And then I took a step back and I'm like, ooh, I mean, they're reading it. You can see a couple of people are taking photographs of things. And then here you see that they've started to kind of group together and they're talking with one another. And I don't know what, maybe 40 minutes into it, people were just chatting away. And it'd be interesting because you can see it's not super wide, and that was great. It was really great that it was kind of in a more intimate space because it encouraged conversation, and like maybe two people were talking about one thing and I'm over here talking with somebody, but the person that, this couple is going, oh yeah, because they're hearing what somebody else is talking about. It really facilitated discussion.
Yeah, and I thought it was great because they also started giving each other credit for the work that they were doing. They saw either people's faces there, or they saw the name there, and they would go up to them and say, "Hey, I really like your picture. That's the same in my family, or that's the same where I'm coming from." And so they would be able to relate to it in that level too. And so it became a very social thing for them to actually relate to.
Did other students at the college get exposure to this, and did they know what was going on?
Yes, and actually I'll address that in a future slide, but absolutely, yeah. So in terms of outcomes, what I'm going to show you next are threads that ran through a lot of students' papers that they submitted, and I just cut and pasted. These literally came from the things that students submitted to me. So one outcome we felt was increased awareness. This assignment opened my eyes and reminded me of the saying, don't judge a book by its cover. When doing this Photovoice assignment, I had no idea what I was going to take a picture of or write about. I then realized stigma was happening every day and it could occur to anyone or anything, mental health condition related or not. And then there's this one. I never really thought of the stigma present in my life. With this assignment, I started to see that there was a lot of stigma surrounding me on a daily basis. I was just unaware of it. So increased awareness. As we just mentioned, it really sparked discussion. What made this project great was being able to speak to others about the stigmas being presented. Viewing each photo and reading each description one at a time, I was able to give my opinion to a friend, and the same friend was able to give their 2 cents to me. And while looking for inspiration and ideas for my project, I was able to discuss the topic with my friends, family, coworkers, and peers. They were all able to talk about the stigma they see in their lives, whether it was from their race, culture, gender, or diseases. I was amazed to see how stigma was presented in different environments. And then lastly, Joe and I were super excited. Well, we're excited about all of them, but we were super excited about this one, increased empathy and understanding. Through the series of presentations by Joe and the posters on exhibit, I feel like I became more understanding and more conscientious when thinking about people with these disorders. One thing I'll always remember is how it reminds they are not the disorder, but they are a person with that disorder, and we should remember that first. So that's just a sampling of some of the feedback that we got from students. Now, Joe, you had some other outcomes that...
Yeah, I think kind of more of the indirect outcomes from this, but I think it's fascinating nonetheless, is that there's this increased interest in mental health education overall. So at the end of the series, I come back and I say, if you're interested in learning more about this, our office offers free mental health first aid classes. We could schedule one up here at Skyline College, and usually we actually have one scheduled up at Skyline College by that point, and students sign up for it very quickly. To the point where if we only had 2 people or 3 people, and this has happened, registered for the class, by the end of the day after I leave that class, the class is already up to its limit of about 20 or 25 people. So they're really interested in learning more about mental health. There's increased knowledge of on-campus and community mental health resources available to students. And that's the one thing that we stress on the last day of classes. If you are feeling like you're struggling with mental health challenges or wanted to talk to someone because of stress or anything that you're encountering here on, on campus, you do have a psychological services department. Go talk to Bev over in Building 2. That's where their office is. But if you feel like that you can't go there, there are these other resources in the community that you can go access when you go home. Our county mental health department has a clinic over on this location. You can walk in there anytime. Here are some other community-based providers that you can go to for more information. So a lot of people actually at the end of class come and ask me questions about individual resources and how they can go about accessing them. And then that whole stigma, value, self-confrontation, just the way that they talk about, like, man, after doing this assignment, I really realized, how I thought about, people with these illnesses, and I realized, I could very well have the same challenge, and people would be treating me differently. So they start thinking about how they've been treating people, how other people have treated others, and they really want to change the way they think about it, the way they see it.
So in terms of the evaluation process for evaluating whether or not the activity is effective, no, I'm sorry, I'm ahead of myself. In terms of evaluating the assignment, the Photovoice assignment. So that's really up to the instructor, whatever the instructor chooses to do. What I'm doing right now is giving 1 grade for the photo and the caption or their narration. And then I also ask them to submit a paper. And I include the following prompts. I ask them to please explain their photo, and that's just kind of going into their narration a little bit more completely. And then I ask them to choose one other photo and explain how it affected them. And the students knew when they went to go see the exhibit that they were going to be answering some questions. They knew that this was one of the questions they were going to have to answer in their paper. And so as they went around and looked and had discussions, I would ask them, so what are you thinking about for item number 2? Is there one in particular? And they go, what, I don't know, man, there's like 3 or 4. This one I'm thinking about, this one I'm thinking about. They couldn't decide on just one. There were so many that affected them or that they couldn't relate to. And that was nice to hear. Another prompt is discuss if awareness of stigma was increased or your thoughts about a particular population were revised, and you saw some of that as I pulled it out earlier. And then lastly, describe 3 specific things that could be done to reduce stigma surrounding mental illness, including implementation strategies. And that really asks them to tie and apply what Joe presents in the last meeting, the last time that we're together. And so things that they say, you mentioned the pledge. So sometimes they say, I signed the pledge. Or, I plan, my friends will use this particular term, and in the past, I never thought about it. I've used the term as well. But now I'm going to watch my language, and I'm going to call somebody out when they use that term and let them know it's not okay. Students talked about how continuing the conversation with their friends and their coworkers. You passed out green ribbons. Passed out green ribbons, and they said, I'm going to wear a green ribbon. And some of them said, I put it on my backpack. And that was a real conversation starter, because people would say, what's the green ribbon about? They know what a red ribbon's for, they know what the pink ribbon's for, but they're like, what's up with the green ribbon? And so that was a really great way to start conversation. So this is just a prompt that you could, if you wanted to present an instructor with a full package, this is something that maybe they could use or certainly build on. Costs, oh my gosh, okay. The number 1 question that an instructor is going to ask you is, how much time is this going to take me to prepare? That's the number 1 question they're going to ask you. And you can say, minimal. Here it is. I've already got it done for you. Class time's a little bit trickier. That's a hard one to get around because you are asking a faculty member to give up class time. And there are lots of things that we can do. We can assign outside reading. A lot of us use supplemental websites. So you can assigning things on a supplemental website would be a strategy. But you do need time in at least 4 class meetings. Once to introduce it, once for them to do the group stuff, once for the exhibit, and then once for Joe to come in and wrap things up. So at least 4 class meetings. We were just trying to think of anything. Honestly, we were like, what can we tell them? All the planning you'd have to do. I had to walk across campus to get my parking pass, to send to Joe. So there's minimal time there. And then the equipment is already in the classroom. We just had to bring this little memory stick, and that was it. Everything else was supplied. And then Joe's.
Yeah, I mean, and the reason why we put this slide together really is if anybody was thinking about, well, what's this going to cost? How much time is it going to take out of my day to do this? It's really minimal.
Yeah.
And the reaon why this partnership works is because Skyline may not necessarily have the capacity to have for they themselves to talk about stigma, to think about stigma, to present about stigma. And so when we come to the table, we bring that level of expertise and experience with us, and we can provide that for them. In terms of my costs, I mean, it's my time, which is roughly about 8 hours for the entire thing. I have to travel 15 miles up north to get there, but big deal. Printing and supplies is actually something that I want to be more mindful of in the future. Is one of the partnerships that I want to try to work with is their printing department, so that maybe the students can we can open up an account or something. The students can go there and get their exhibits printed in color, because a lot of them are black and white, a lot of them are kind of roughly done. And so maybe we can just add some money to that and say, hey, can we just have students come in for this class and print their exhibits in color? We'll cover the cost. And that's like 20 cents per color page. It's not a big deal for how many students you have in your class, but about 50 or 60. So that's not a huge cost. I provide coffee and snacks for the exhibit launch. I bring some Starbucks and some treats for people to come by and munch on, because we launched this like early in the morning. And if we wanted to, we could provide student incentives. We could do something like vote for your favorite exhibit, and the winner's going to get a $20 gift card to Target or something. I mean, and the reason why I throw this out there is because it's very, very minimal, and we're not talking about a lot of work, and we're not talking about a lot of costs, but the impact could be huge for the students. So I say it, overall time and cost to implement the class was minimal from both sides.
So is it effective? You saw what students were saying, but in terms of effectiveness, in terms of formally assessing it, we have not done that. The evidence is completely anecdotal. With this last Photovoice, I received photos and assignments from 43 students, and every student said the assignment was a very positive experience for them. And then they said what Joe, you said earlier, it was more than they had expected. It was more than they had anticipated. It had more of an impact on them. It was much more powerful than they had anticipated, so that was some nice feedback. Having said that, we may do a formal assessment using clicker point technology to do a pre-test, post-test in terms of if there's any attitude change, knowledge change, and so on. The assignment's not formally included in the course outline, and honestly, I don't know if it would be, because it's just kind of a standalone to supplement what we talk about in class, but it is not formally included in the course outline. And so right now we just kind of look at it as a promising practice as opposed to a best practice until we start to collect more information. Now you asked about, do we keep it up? So here are some things that we learned last time around. It's best displayed in a hallway or a classroom as opposed to like scattered throughout campus. And one nice thing about that is that because of the close proximity that students were to each other, it really kind of helped facilitate discussion. So that was nice. We do leave it up for a week. Actually, I think we got it extended last time to 2 weeks. And I invite other faculty members to bring their students, and I know that different faculty members have offered extra credit to go up, take a look, and they had some prompts for them to answer for extra credit. It was awesome, you guys, because it was right outside my office door. So I'm just looking, I'm typing, oh, here comes so-and-so, oh, here comes so-and-so. So we had a lot of faculty come up, we had administrators come up, and that was really nice. So leaving it up for that time allowed more individuals to kind of come through. It's also a spot where right around the corner students naturally congregate, so we just got a lot of foot traffic that way. We had an opening. It just made it feel fun for the students, made them more excited about displaying their photos. Copyright issues were things that we addressed because some students said, you know what, I saw a picture in a magazine that I thought was a really good illustration of this particular thing. Can I just take a picture of the photo in the magazine? We're like, no, you can't really do that because copyright issues. And Joe had a great idea. He's like, just recreate it. So students would recreate maybe something they saw in a magazine that they felt was a good example. The college did require signed releases by students whose photos included a face, and that was a set thing that the college already had. I just had students fill it out. A couple of students used nieces and nephews or younger siblings, and in that case, their parents had to sign it. And the student that I showed you, the reason I could show you that was because I've got her signed agreement on file. This was the hardest part, was getting permission from the college to display photos. Not because they didn't want to, just because there were a lot of hoops that I had to jump through. You know, I seriously was just going to go and just staple them on the wall and tape them on the wall. And thankfully, I mentioned to somebody, oh yeah, I'm going to do this. And they said, well, did you get permission from so-and-so? I'm like, what are you talking about? You know, so there was this whole process I had to go through to get permission. I had to go to the president's cabinet and stuff like that. So, you know, if you're planning on doing Photovoice, that's something that you want to be aware of early on, because I think I got permission. I started with the whole permission process in, I don't know, February, and it took quite a while to get that done. And then one thing you might want to do is post information about psychological services available on campus kind of throughout the displays. One of the things the college asked me to do was ask students to be mindful of the photos that they were going to put up, because it was right around the corner from the Veterans Resource Center. And they were concerned that maybe some photos might trigger some stuff, which is a very valid concern. And any of the photos could have done that, some more so than others. So posting just little flyers, sporadically throughout with, psych, and thankfully, coincidentally, psych services was just directly downstairs. So where services were available, contact information, and so on. And then you had some lessons also.
And yeah, it's more just formal wrap up of everything that we've talked about. The combination of showing those interviews and having discussions was really helpful in the stigma education piece. When I first did this, I think all I really did was lecture, and I think I lost a lot of them in the very beginning. So, when I started throwing in videos and having discussions about it and doing question and answer, I think that's where people started engaging and getting a little bit more involved in the topic. The Photovoice assignment was really I think, at least anecdotally, we found it to be very effective in terms of raising awareness around stigma, and for people to say that this is really going to change the way I view people or individuals with mental health challenges.
And
obviously.
If I can add something there, because we kind of went at them sideways. It's so much like a lot of the posters I see talk about stigma. That's something I've heard all day today, stigma, 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 and talking about different kinds of stigma. This assignment, though, allows students to experience it. So you kind of come at them sideways, and they're like, oh, it's happening for me. Oh, okay. And just, different perspective, a different, different way of experiencing it.
When we lead off with an exercise about labels, and then that's what kind of opens the door, because everyone has been labeled at some point, in their lives, and everyone identifies with themselves a certain way, and it may be different than what other people or how other people see them. So once you tap into that understanding, then you can get them with stigma. And really, this partnership, I think, is a very valuable thing to explore and thing to have, because it really maximizes the strengths of each of our entities and each of our agencies, and it really opens the door to new opportunities. One of the themes I've heard people talk about today was sustainability. Like, oh, we don't know what we're going to do because this grant's ending, with the student mental health stuff, in Cal Mesa. The counties are still going to have resources available to do this work. Reach out to folks who have been doing this work for a long time, and who are going to continue doing this work, for a long time. If that means your county health department, so be it. If it means the state, so be it. But think about the different partnerships that are available to you, and the resources that are around you, and think differently, think creatively how to get that done. And this is something that Jennifer reminded me of, is to use the contacts at College Psych Services to maybe introduce you to faculty members who are teaching this material, so that you may know who to approach when doing this. If you want to do this at your agency or at your campus, have people who work at Psych Services introduce you either to folks at the local health department or folks on campus. If it's me coming onto campus, then I would need to know who these people are. But if it's Jennifer approaching our health department, she would probably work with the folks and the counselors and the therapists at Psych Services to be able to connect with me. So you really use those bridges. We forgot to choose this middle bullet.
I know.
So in terms of next steps, we obviously want to do some sort of a robust evaluation of this series. and thinking about ways to integrate this with the feedback that Jennifer gets from the students, whether it's some sort of a clicker thing and pre and post, or some sort of a formal, Likert scale type of evaluation. We're not sure what that's going to look like yet, but the more we do this, then the more we can actually think about how we want to integrate evaluation into it. I was actually supposed to edit the second bullet, consider involvement with other psychology courses, because in the community college setting, there may not be a lot of courses or class opportunities to dip into with regards to psychology. In university settings, maybe there'll be more college courses to attach this type of a project onto, whether it's general psych or social psych. Actually, one of the other areas that we're exploring, at least in Skyline College, is other disciplines are now starting to approach psych services and saying we need some mental health education in our curriculum, because let's say, for example, we were approached recently by the cosmetology department at Skyline. That's the department that trains people how to do hair, people who are doing the nails and the hair, and they're saying we need to get our students trained in this, because we're hearing from our alumni who come back and say there's people who are sitting down in our chairs talking about their mental health problems all day. And we don't know what to do about it. And so now they want us, so Beverly, who's a counselor at Psych Services, says, hey, can you guys teach a mental health first aid class to the cosmetology department? Well, by all means, we can. Use that partnership, yeah.
I would encourage you to present this to educational institutions training human resources.
Sure.
Absolutely.
Actually, one of the first times we taught, and that's a great suggestion, one of the first times we taught mental health first aid up on the Skyline campus, I think one of the vice chancellors for personnel or for human resources was in attendance, because she was finding more and more of these issues happening with personnel. So that's a great suggestion.
Also, because HR is in charge of within their organizations in leading diversity and inclusion.
Mm-hmm.
That's an HR function in the corporate world.
Great.
I'm thinking interdiscipline. I'm thinking graphic
Yes.
design.
Yes.
You can partner with the graphic design and make these really beautiful posters, and perhaps have a contest out of it.
Yeah.
And there, you can really, because you got Mental Health Awareness Month in May,
Yeah.
and
Right.
do a full-blown campaign.
Yeah, actually, yeah. And in the last semester, it happened around that time,
Right.
and we talked about Mental Health Awareness Month, and we're able to make the connections. But those are some great
You make
ideas.
it a service learning project.
Sure, absolutely.
Hold on.
See, the issue now is capacity, because we're only a 2-person show here, so and I have to already think about expanding to other schools in our system. But it's great, because we're still working out the kinks in this whole thing.
Yeah.
But yeah, we're thinking about these, all these different possibilities. And when other departments are starting to approach us and say, hey, we want more of that training here. Hey, we saw what you did with that Photovoice assignment. How can we get involved? It really starts generating this energy around it. I think it's great.
The cost makes sense, because think about how much we spend on posters. Like, you go out and buy all these things,
Sure.
all this money, all these, when you've got people right there. resources.
Yeah, printing services on campus, and
Yeah.
take a night on that.
And I had a student in my class come to my office hours last week and say, I do supplemental education. I also work with a Jumpstart program at a high school, and my students tell me a lot of stuff. We get really close, and they're sharing stuff with me, and I don't know what to tell them. I don't know where to send him. Do you think that Joe would come talk to us? I'm like, absolutely. So, be looking for an email from Berto. He's going to be calling. No, heads up.
But I think that's important. I think for our county, it especially makes sense. When our school systems is we have 3 community colleges. They only have so much capacity to be able to provide treatment services to the students on their campus, and so there has to be some place to send them. And so I talk to their clinicians all the time about can we work on a system of doing a warm handoff between students who need higher levels of care but they can't get it here but are eligible for county services. I'm like, absolutely, that's what we have to talk about. So I think that opens up the door to bigger issues and bigger system issues, and having this has been a great relationship. I wanted to end by acknowledging, I think it's important to acknowledge these people. Obviously at Skyline College, Jennifer's Dean of Social Sciences and Creative Arts, the psych counseling services at Skyline College, and in my health department, our director, all of these people are involved in senior management and senior administration, they're very supportive of this partnership. And I think that's one thing that's understated, is that we can't do this work unless we have the support from the higher ups. So if you're thinking about doing this kind of, or implementing this kind of a partnership, or doing this kind of a program, make sure that you involve senior folks in it very early on, and that they give you their blessing to do this work. Otherwise, you don't really have that push to get this work done. So, sorry for talking so long. I hope you were excited about it as much as we were. And we're available for any questions.
Super quick,
Yeah.
graphic art, right?
Yeah.
And service learning, and present to HR, right? Does anybody have any other suggestions for us?
Doing it in May.
May?
May, yes.
Making it a
Making it a
contest.
contest,
Kinda
right.
like